So next tumor will be GIST, which is gastrointestinal stromal tumor. So stromal, in the sense, it is going to be a mesenchymal tumor, and GIST is the most common gastrointestinal mesenchymal tumor. Here it is going to be associated with Carney's triad. Okay, so Carney's triad is a triad of GIST along with paragangliomas and pulmonary chondromas. But confuse it with the Carney's complex. Okay, Carney's complex was different. So these two are not the same. So Carney's complex, where did we see? We saw it in myxomas, right? So atrial myxomas we were reading. So Carney's complex will have these cardiac and extracardiac myxomas along with skin pigmentations and endocrine abnormalities, right? So that was an entirely different kind of thing, different from the Carney's triad. So GIST is associated with Carney's triad and myxomas are associated with Carney's complex. So what is the origin of these gastrointestinal stromal tumors? It is going to arise from the interstitial cells of Kajal. So interstitial cells of Kajal are present in the muscularis propria. So these are going to be present in the muscularis propria layer, and from there it is going to arise. So grossly, if you see, the tumor will be seen not on the mucosal aspect but from the wall of the stomach. So it will be present on the outside part. So starting from the muscularis layer. And usually we have various mutations like c-KIT mutation, PDGFRA mutation and SDH mutation. So SDH stands for succinate dehydrogenase, which is again an enzyme involved in Krebs cycle. So c-KIT mutation will be the most common mutation, and when c-KIT mutation is present, it is going to express CD117. So c-KIT and CD117 are basically the same. So on immunohistochemistry, to prove that it is having a c-KIT mutation, you can put CD117. So immunohistochemistry, CD117 will be positive, and CD117 is the most sensitive immunohistochemical marker, while it is not specific. But DOG1 can be used as another IHC marker. So DOG1 IHC, it can be used because it is the most specific IHC for GIST. Okay. Why is it important for knowing this c-KIT mutation and proving it with CD117? Because we have targeted therapy. So wherever we have the c-KIT mutation, we can give imatinib mesylate therapy. So targeted therapy imatinib mesylate can be given. So where else did we see this name imatinib? Yes, in CML. So where else did we see this imatinib treatment? We saw it in CML, chronic myeloid leukemia. So there also we had this imatinib treatment. So in GIST also we can give imatinib treatment. And morphologically, if you see, GIST is composed of either spindle-shaped cells or epithelioid cells. So epithelioid cells will appear in epithelial cells, so quite big. So the most common morphology will be a spindle cell morphology only. And GIST is not just present in the stomach, so it can be present in the intestine as well. So gastrointestinal tumors, right? So in the intestine, it is going to have more of a spindle cell morphology, while in stomach, it is going to be epithelioid morphology most commonly. Okay. So there is a risk stratification for classifying this GIST as benign or malignant. So the malignant behavior of this GIST will be determined by the size of the tumor, the location of the tumor, and also the number of mitosis. That is the proliferative activity of this GIST. Okay. So based on the size, location, and mitosis, we will determine whether the GIST is malignant or not. So this is the gross image I mentioned. So if you see, this is the luminal aspect, but the tumor is not arising in the luminal aspect. You see the tumor arising from the wall of the stomach. So this entire thing arising from the outer aspect is going to be the GIST, because its origin is going to be from the muscularis propria. So microscopically, if you see here, it is all composed of this spindle cells, and here also you see these kind of paranuclear vacuoles. So these paranuclear vacuoles are characteristically seen in GIST involving the stomach.